have to realize that these athletes are putting, in all sports, their long-term health at risk. The Drake Group supports lifetime health coverage, health benefits for athletic injuries.
At 19 and 20, having back and hip problems, that their therapists and their trainers are telling them that they're gonna last a lifetime, and that could really impact their reproductive health. I think for me, that really put in perspective. I've seen athletes with fingers that don't look like fingers anymore, because they've been injured so many times and they've been pushed through surgeries and pushed to get back on the field.
I don't think it's going to be if we just allow every school or every state to just kind of piecemeal it together. It's just not going to be very successful. And I think that needs to be done at a congressional level.
Students are putting their bodies and livelihood at risk for quote unquote academic scholarship. Long term, it's not fruitful.
It's not just coaches, it's athletic directors, it's associate athletic directors, the internal and external operations folks. You might get some pushback from the trainers, but we're pushing kids back earlier than they should be.
Particularly in football and other contact sports, many of the athletes suffer brain damage later in their lives. It might be 20, 30, 40 years after they graduate from college that they have massive medical bills and need care.
The NCAA started as an organization to protect the health and welfare of the athlete, and even recently filed an amicus curiae in a court case saying that they have no responsibility to protect the individual athlete from sexual abuse, or no responsibility to protect the athletes from injuries, from concussions, basically saying they made their own free choice to play. We as a governing organization have no responsibility to prevent that. I certainly think that that is ludicrous.
I witnessed many other athletes having surgeries, dealing with severe injuries that will affect them for a lifetime. Many paying for treatment themselves, including out-of-pocket expenses. And they really should have that support from the institutions that benefit so much from their sacrifice.
We need to recognize that we might know them for a few years, but mental health is a forever issue. And so I think that's where we need to put a lot more resources.